One of the most disturbing aspects of the COVID-19 pandemic in the U.S. is the disproportionate harm that it's caused to historically marginalized groups. African American, Hispanic, and Asian people have substantially higher rates of infection, hospitalization, and death comparably. We need to educate these communities, and to help with that is Dr. Michael Howell, Regional Medical Executive, Southeast Region, Cigna Healthcare. Dr. Howell, thank you for being with us today.
Thank you, and it's my pleasure to work with you.
So why is there such an issue of avoidance toward certain communities when it comes to the vaccination? That's what we're starting to see now. A little bit less with COVID-19 itself, but a lot with the vaccination. What's behind that?
Well, thanks for the question. You kind of have to go back to the concern of vaccine trust. Trust in the healthcare system in America is a challenge for both Black African Americans and our Hispanic community. A lot of that trust goes back to what we've heard in the past from great-grandparents, grandparents, maybe some parents. And it talks about some of the injustices and the mistreatment that occurred with Blacks in early 1930s, 1940s. The signature case always tends to be the Tuskegee syphilis study, where Black men were recruited for a syphilis study to observe long-term effects of syphilis. And when the treatment came along in the 1940s, which was penicillin, they weren't offered that treatment. And many of those men died. They also infected their partners, who also might have had extensive disease or death due to it as well. So it's things like that that really concern Black people. You also have other instances where the father of modern gynecology, actually Dr. Marion Sims, actually practiced experimental procedures on slave women, Black women. And that also occurred without use of anesthesia. So created a lot of harm, mistrust. So that has perpetuated throughout the years. It's still there. And we've got to make sure the right information gets out there about how we practice medicine today, how the healthcare system is today, to help dispel some of that.
And the sad thing is that with that context in place, we also have the overwhelming evidence of the impact of COVID-19 on communities of color being dramatically different than they are on the larger population. So how do we deal with the COVID-19 as a disease that is spread throughout all communities, and realizing that the impact of mortality particularly and hospitalizations are really heavy in communities of color?
Well, let's go back to some of the reasons, I should say, why COVID-19 has impacted communities of color. You think about the businesses in our town, we're a service industry, and 50% or more in some cases of the employees of some of the companies that work in that industry are people of color, people who speak different languages, come from different countries. Because of that particular disparity, if you will, a distribution of people of color in those industries, you go back to let them go home now, and you realize that they live in a situation where there's multiple family generations living in the same home. They didn't have access to some of the supplies and services available at the beginning of the COVID outbreak. So then they're in environments where they couldn't prevent getting infected. And if they got infected, they then could not keep other family members from getting infected, nor did they have access to go to the healthcare services because everything closed down. So now you've got people who are at risk. They're crowded together in some situations, don't have the right supplies and equipment to remain in a COVID-free environment. Then when COVID strikes, it spreads catastrophically. And it just created a lot of illness and in many cases death in our community. You look at other communities that have better resources, they don't always have the same limitations to prevent disease from influencing their livelihoods and their lives.
And does that also play a role in why so many communities of color, people have underlying health issues that really do add to the COVID-19 impact that they have on their bodies individually? Is it all connected to the fact that these disparities are a product of lack of healthcare access and all the other things that you just mentioned?
Well, when you talk about healthcare access, I think about social determinants of health And basically, they look at things like access to care, transportation, infrastructure, access to food, education, et cetera. You think about communities of color and how they have the transportation means, access to care. You have many places you have a car. Many of our communities where our people are being impacted, they have to take the bus. And when you have to take the bus multiple stops, it really is a dissuader, if you will, of whether or not you're going to go to the doctor for that appointment at the frequency the doctors may want you to. It makes a difference, excuse me, in whether or not you're going to get on that bus or try to take a cab or walk to the pharmacy to pick your prescription up. And we're not doing those basic things. The disparities in society influence how we access the system, and how we access the system determines the outcome of our health if we're not getting the right services or right treatments at the right times.
And there's almost like two separate mindsets when it comes to the vaccine. There are some people that can't wait to get it, and there are some people who want to wait and see. How do we work to help inform our family members, friends, our neighbors about the vaccine, and what should we say? What should we be saying to people about getting vaccinated?
Well, I was asked the question, why did I get vaccinated? The answer is pretty simple. I realized that COVID-19 was killing people of color. In fact, COVID-19 was killing people, period. COVID-19 was making people awfully sick. And I determined to get the vaccine because I did not know if I was going to be the one that would get severely ill, end up in the intensive care unit and or die. And I simply wanted to have the opportunity to have a choice not to be in that situation. The COVID-19 vaccine has demonstrated that it has the ability to prevent hospitalization, serious illness, and death. So for me, the equation was pretty simple. Here's do nothing and potentially get very sick, end up in the hospital and die, or here's a preventive method that I can embark upon or take that will allow me to avoid those negative consequences. Now, how do we get that message out? We've got to make sure we get the message out to people by people who look like the people we want to talk to. We have to make sure we're doing it and getting the message out in the language of the people we want impacted by it. So I have to make sure that we're doing the right thing here. I need to make sure that I'm doing everything I can to talk to people to say, look, we need to take advantage of it. I'm not going to tell you to take the vaccine, but what I will ask you to do is listen to the facts. And once you have the facts and the correct information, you have to decide, just like I did, do I want to avoid severe illness, hospitalization, and death because I can, or do I want to sit back and wait and potentially become infected by this deadly virus and potentially have all those negative consequences, including death? Now, keep in mind, the decision I make impacts not only me, but it impacts my family, my friends, and anyone that I'm around. So I need to also think beyond myself and think about others. And finally, I would tell you the value of correct information can't be understated. We need to make sure that as we look for information, we're hearing it from credible sources, but there's enough information out there besides Twitter and Facebook where we can get good information. Now, I'm not knocking any of those sources because you can get good information that way as well. But when it sounds a little off, it probably is a little off. And you need to make sure that you validate what you hear to make sure that it is accurate, because this is your life you're talking about.
Well, it's very good advice, and we appreciate you being here with us today, Dr. Howell. This is very important information for a lot of people, so we much appreciate it.
Thank you.
And we'll be right back with more. Stay with us.